Hi guys, this is Vanessa with Mommyhood Lifestyle, and today in this video we're going to talk about breastfeeding tips, especially for the beginning of life. The first couple of days when you're trying to get your breastfeeding off to a good start. So some tips you're going to want to start off with is, first of all, it's going to start just from when you're going into labor and you get to the hospital. The nurse, most likely they'll ask if you're going to be breastfeeding, but if not, of course, you're going to want to let them know that that's what your wishes are. If you're going to want to do breastfeeding, you got to start it off right. So some things that they'll do to begin to have successful breastfeeding is that they're going to try and breastfeed within the first hour or so right after they're born. Of course, this is just depends on whether mommy and baby are healthy enough at this point. Most of the time it's able to be done even just immediately right after they're born. Of course, this is just depending on whether mommy and baby are healthy at the time, and usually it's even okay after a C-section. They're able to start with breastfeeding right away so that you can have a successful time with breastfeeding. The nurse will bring the baby over and you're going to start breastfeeding within that hour, the first hour or so after they're born. Another thing that they're going to do is skin to skin time, which is also going to help encourage bringing in the milk, encourage bonding, and then just also help them with breastfeeding as well. So pretty much your skin is going to be to the baby skin. They'll put them on, I don't want to touch the mic, they'll put them on your chest, and then that way they'll be relaxed. And even right after they're born, normally they'll put them on your chest, and the nurse is still able to do their assessment and everything so that you can hold the baby while they're doing that, and that'll encourage the great breastfeeding as well. And then of course you're not going to want to give them a bottle in the beginning, at least, or a pacifier, only because it can cause nipple confusion at the beginning. Sometimes pacifiers are okay, but especially if you really want to use a pacifier, I mean, just do whatever feels right to you. Just in the first couple of days, at least try to just use the breast, because the nipples are different. Just in the first couple of days, try and just do exclusively breastfeeding, because the pacifiers and the bottles have different types of nipples, which, like I said, will cause nipple confusion as well, and can discourage you and cause delays in getting them a better latch in the beginning. So these are the couple of tips that you're going to start off with in the beginning to have successful breastfeeding. Next, we're going to talk about the hand expression for getting the colostrum, because in the beginning, the first couple of days, you're not going to actually have your milk, especially if you're a first-time mom. It's going to take a few days for your milk to actually come in. But what you do have in the beginning is something called colostrum, and it's either like a yellow or clear type of milk that comes out that you're definitely going to want to give your baby. So of course, try to get your baby to latch on as early as possible, but if they're not latching very well and they're not able to get the colostrum out as well as you'd want them to, you can always hand express it out and then give it to them. The nurse could help you give it to the baby with either like a syringe or something to just kind of get it on their mouth, and then they'll swallow it down. And it's really good for them to get this colostrum because it helps to promote, it's very easily digested, so it helps to promote them to poop, actually, which is something you want them to do, especially since it helps, pooping will help them prevent the jaundice, which is what the yellowing of the eyes and the skin, which happens for a lot of babies in the beginning of life. So getting that poop to come out is something you definitely want to do. Another reason is that the colostrum has a lot of antibodies and properties that help the baby to fight disease and help them to not get sick in the beginning. So that's why it's important to give them this. And let me just show you how to hand express it. I've got the trusty little nipple here to kind of show you how it's done. So you're going to want to hold the nipple like a C, maybe about 2 inches away from, sorry, you're going to want to hold the breast 2 inches away from the nipple, and then you're going to want to push back towards, in the direction back towards your rib cage, push back and then squeeze it together and maybe move a little bit forward, kind of like roll it down so that you can get the little, it might take a few minutes, but then you'll start to see little tiny little drops come out, and it's either like a clear or yellowish. It's kind of sticky, so that's why it's best to do it hand expression, not with a pump, because you're probably going to get most of the colostrum just on your pumping, you know, mechanism, and you won't be able to give any to the baby because it'll just be stuck in there. So the easiest thing to do is, again, you're going to want to push back towards your ribs and then forward squeeze towards the nipple, and then just keep doing this. Take a few minutes, try not to get your nipple too sore or anything, but it'll help promote it to come out as well, especially also to help promote the milk to come. And then you can use like a little cup or a spoon even, just to get the little drops, and then you can use those, and then you can just, the nurse can help you put it into the baby's mouth and, you know, just kind of rub it around their lips, and they'll get some of that colostrum for sure. So that's how you're going to get the hand expression of the colostrum, okay? So now we're going to go into some of the breastfeeding positions. I know most of you probably have one of these. It's a little boppy pillow. This is what I use, especially in the beginning. It kind of fits around you like this, so that, you know, you're able to put the baby right there close to your breast level, which is pretty convenient. Especially since the babies are so little at this time. Fortunately, this is the only thing I have as a baby substitute for now. The first hold that we're gonna go over is just kind of like the laid back hold, which is actually mainly when you're in the hospital, kind of laying down. Maybe you're gonna be reclined in the hospital bed like this. I don't know if you can hear me. So you're gonna have the baby kind of like this, relaxed, kind of laid back, exactly like as the hold says. And most of the time the baby will be able to find the nipple on their own. And then you just kind of support their head with the middle of your arm and let them get a hold of the nipple like that. So that's the first hold, the laid back hold. The second hold is the cross cradle hold, which is kind of similar, but you're leaning a little bit more forward, and then you're gonna cross them like they're crossing over to your chest, and then there's gonna have tummy to tummy, so they'll be kind of have their tummy right there on your tummy. And then you're gonna support the back of their head and neck with your other hand, right hand. Well, in this position it'll be your right hand, kind of like this. You're gonna have the forefinger and thumb at the base of their skull, so that you can hold their head up. And in this position you're gonna help them find the nipple with your other hand. You know, hold your breast with your other hand away from the nipple, of course, and then bring their mouth to your nipple. So that's how you're gonna kind of do it in this hold, and just like that. Okay. And then we have actually the hold that I preferred for the first couple of days of life, especially once my milk came in and I was a little bit engorged and having trouble getting my baby to just get that milk out, you know, just draw it out for me. So this hold was a lifesaver for me, and it's called the football hold, kind of like you hold a football, the clutch hold actually. Clutch, quote unquote, football hold. So you're holding your baby kind of like a football. Again, you're going to support the head and neck with holding them at the base of their skull with your thumb and forefinger. Again, it's going to be on the side like this, and it's actually a better position for them to latch on with a nipple. It helps them. It's a different angle for them, and it's actually a better angle in the beginning. So at this point, you're going to hold also your breast again and bring the baby's mouth to your breast and help them like that and support them. And then once they're latched on, of course, you can kind of relax a little bit too, just like that. So that's the clutch or the football hold, which is very helpful if you're having trouble getting your baby to just really draw that milk out, bring it down, get that let down to come down. So this is a really good position. I really like this position, at least for the beginning. Once they start getting, you know, becoming pros at latching on, then you could just find whatever position is most comfortable for you guys, you know, across, laying down, which is actually bringing me to the next position, which is the side lying hold, which you'll be doing actually when you're laying down in most likely your bed. So I'm going to try and kind of explain it and show it to you here, but obviously you'll be side lying like this. Your hand, and you know, you can have your arm like this, and then your pillow will support your neck, and then you can get a pillow for the baby as well. Bring it around to their back, and then you'll be like this, kind of tummy to tummy as well. And that way, you know, this is usually once they're better at grabbing on and getting a better hold. And they have a good latch in the beginning. Once they get the good latch, after that you can kind of do this hold, and it's easy to just relax, both of you relax, and then it also releases the tension from your neck from all the other times you've been breastfeeding and you're kind of hunched over. You know, try not to hunch when you're breastfeeding, even though it's super hard. Just ask your husband or hopefully your significant other to put pillows all around you. Pretty much use a ton of pillows just to keep yourself comfortable. Otherwise, you're gonna end up with, you know, your neck is not going to be thanking you. But so those are the basic holds that I wanted to go over with you, I used all of them for the babies at the beginning of life for my 2 little guys. And next we're going to talk about how do I actually attach the baby to my breast, which is most of the time the hardest part for most first-time moms, is learning how to just get that latch. And because it's a learning process, I had, you know, trouble in the beginning. Everybody does. I mean, it does come naturally, but it's a learning process for both the baby and the mom. So let's just go over that. Hold your breast far away from the nipple and maybe just kind of squeeze a little bit. It helps to get your nipple and everything a little bit smaller for them to get it in their mouth. You can kind of rub their cheek a little bit. It kind of stimulates that reflex for them to know that it's time to eat when you rub their cheek. You can also just kind of put their nose and their lips, maybe rub it on the nipple a little bit so they know, like, you know, they can smell, oh, we're right next to the milk, it's time to eat. And it's right there so they can feel, because obviously they can't see in the beginning. And so it's mainly just on feel and sense of smell and things like that. So that's why it's also hard in the beginning, because they don't really see the nipple. They just, you know, they're going by what, you know, they can feel. So you're gonna want to kind of maybe just rub it around their cheek and maybe their lip, and then once you get them to get that big yawn, I mean, you want it to be wide as possible. It doesn't always happen, but just try and get their mouths as wide as possible, and then you just want to gently just pop them on there once they get it wide. And you're definitely gonna want to get as much of the areola, especially on the bottom of the breast, of the nipple, in their mouth as possible. So again, as much of the outer area, which is the dark circle around your nipple, that's your areola, right there. You're gonna want to get as much of that in their mouth as possible, because that's gonna get you a better latch and be less painful. Because if you start getting just your nipple in there and it's causing pain and things like that, then it's just going to discourage you from breastfeeding, which is not what we want, especially since it's so good for you and the baby. So if you have a good latch, you might feel a little bit of pressure and tugging in the very beginning when they're first latching on, because they're just, you know, trying to get on there. But if it starts to relax and you feel, okay, this is not painful anymore, once they're continuing to suckle on it, then you probably do have a pretty good latch. If you are feeling pain still and it's tugging and you just, you know, it's not comfortable for you, then it's no problem. You just need to detach their latch, and it's easy. You're just going to want to kind of slide your finger by your breast and then into their mouth. Slide it on the side of their mouth so that you can break the seal, because you don't want to just pull them off, because they're putting a lot of pressure on your nipple and it's going to be painful as well. So just kind of break the seal first and then take them off, and then just try again, just trying to get them to get that wide mouth again, and then put them back on, get that as much of that areola as possible so that they can have a good comfortable latch for both you and the baby. It's going to take practice. It's going to take some time. The first couple of days are the toughest parts normally, but if you just continue at it, it will happen. Most of the time they do learn pretty quickly, and it gets easier and easier. Trust me, it does. So for breastfeeding, you're going to go with feeding them as often as your doctor recommends you to feed their baby, especially to help them gain weight in the beginning. I mean, it's normal for them to drop some weight right after they're born, because obviously you don't have your milk in the first 2, maybe 3 days that they're after they're born, which is important, why it's important to give them that colostrum in the beginning. But you're gonna try and wake them up. Normally, if they're very sleepy, sometimes it's almost impossible to wake them up, and it's normal for them to have maybe one sleep period where they'll sleep maybe for like 4 hours long, which is pretty normal. I mean, you want to try and still wake them up if you need to, if they haven't eaten in a while. Definitely if it's been more than 3 hours in the first few days of life. To get them to wake up sometimes is probably the hardest part. The trick that I did with my son, especially since he was born a couple weeks early and he was pretty sleepy in the beginning days of life, I would just use one of these little wash towels for their bath and have it by me. I would keep it wet. So I would go and get it wet and then have it by me when I was gonna breastfeed, and then just kind of use it to rub on their bellies, on their feet, because it was wet and a little bit cold. I mean, it sounds cruel, but seriously, like, the babies are super sleepy. You need to keep them awake so that they will eat. Especially being on the breast, it's a lot more energy that they use because it's harder than a bottle, but still good for them, obviously. So they'll fall asleep more easily on the breast, but you want to try and keep them awake. Tickle them, tickle their feet. You know, I would just kind of rub the rag around their belly because it was cold, and then obviously I would just take off their clothes most of the time, at least maybe just a little hat on, or just keep their, maybe if they had like a little sleeper on, just keep it open, keep their feet out so that they were like, oh, okay, I'm awake, and you know, I'm alert, so that way they can eat, because you want them to try and eat at a timely manner. If you go over, you know, maybe 30 minutes or so, if it's taking too long, then they just get super tired again. Obviously, babies do not stay awake for very long, especially newborns. They don't stay awake for maybe like 45 minutes at a time. Even then, that's pretty long. So that way you can try and get them to eat within that time period, and then before they fall asleep again. So that was one trick I used that actually really helped, was just a little wet washcloth, help them stay awake. Also, what's pretty normal with babies at this stage is that, like I said, they'll have maybe like a period of where they'll sleep for like 4 hours, and then you're like, suddenly when they're awake, they'll wake up maybe every hour to eat, which is fine. It's like a cluster feeding that they'll do. And then, you know, just feed them on demand. That way you can get that milk to come in. You get your milk supply to come up. That's the best way to get your milk supply to come up, is feeding on demand. It's actually not necessary to pump in the beginning to build up your supply, especially since your baby's tummy is super small. It starts off the size of a marble, which is like only about a teaspoon of milk is what they need the first day of life. And then it starts to grow as they grow bigger. Maybe by day 10, it's about the size of an egg. So you don't need to pump and get your milk to come in is super, you know, so that you have so much milk to where they're getting too much milk in the beginning. So usually after about the first month is when you can start pumping and building up your supply, and you'll want to pump usually an hour before you're going to breastfeed. I know it's hard to time and you're trying to get sleep, but actually I'm going to go over a video about pumping in the future so that you can have more information about pumping, especially if you're going to be switching over to a bottle from breastfeeding, because I know a lot of moms nowadays have to go back to work, unfortunately, and somebody else is going to be feeding your baby, so obviously they're going to have to learn how to switch to a bottle. So if you want to see a video like that, please subscribe to the channel, especially if you like this video, and if it was informative, please give us a like, thumbs up. And I'll try to bring more videos in the future on breastfeeding as well. So thank you for watching.